Mr Speaker. My question is for the Minister for Health. Minister, Australians are struggling with the cost of living pressures. In 2018, the PBAC recommended allowing prescribing of 2 months of a time supply for 143 medications. This would save dispensing fees of up to $180 a year per prescription medicine and will take pressure off GPs. Will you commit to decreasing healthcare costs by making this change to the PBAC?
The Deputy Leader of the Opposition will cease interjecting. I give the call to the Minister for Health and Aged Care.
You think they'd have learned about interjecting on the member for Kooyong. But this is an opposition that doesn't appear to learn, Mr Speaker.
Order.
I thank the member for Kooyong for her question, and I appreciate the contribution that members of the crossbench, particularly those with such long experience as health professionals, are making to a really difficult debate about healthcare right now. It's never been harder to see a doctor. It's never been more expensive to see a doctor. And at a time of really severe cost of living pressures, just those basic questions about whether you can take a script to your pharmacist and have it filled, or whether that will place too much of a burden on your household budget, are real pressures on hundreds of thousands of Australians. We've heard from the ABS that almost 1 million Australians every year either defer or go without a script that their doctor has given them as important for their health because of household budget pressures. Now, for the first time in 75 years, on the 1st of January, there was a substantial cut to the price of general patient scripts, down from $42.50 to $30, and already that has saved tens of millions of dollars for many Australians. Made a real difference not only to their household budget but importantly to their health care as well. The member for Kooyong is right that the PBAC has made other suggestions about ways in which that cost of living pressure, but also the convenience of patients can be improved and those pressures can be alleviated in terms of the number of times they need to go to GPs, get scripts or go to the pharmacists to have their medicines topped up. We're obviously looking at all of those options. There's a budget process underway. We're looking at all of the options available to government to make access to health care better and easier for patients, and to make the cost of health care, including the cost of medicines, even cheaper. So I'm not in a position to make any particular announcements this afternoon, Mr Speaker, but I thank the member for Kooyong for her question. These are all matters that we take very seriously, because we know, in spite of the fact that the change we introduced on the 1st of January has already had an enormous impact, enormous beneficial impact on patients, a change supported very strongly by the community pharmacy sector. There is much more that we can do, and we're examining all of